Okay, today we're going to talk about sorting patients out depending on their vital alterations in a mass casualty using the triage tag. This is what a typical triage tag looks like. And it's usually the paramedics or the first-hand medical services that have this. But you as a student, you're in an accident scene and you want to help sort patients out before the real medical personnel arrives. What do you use? You could use colored papers if you have in your bag, or colored pens. Okay, what do these colors stand for? We have black, red, green, and yellow. Black stands for a patient is deteriorating or deteriorated. The patient is dead. There's no respiration, or you cannot help the patient because it's at the verge of dying. So, and the patient is usually transferred to the morgue. Next, we have red. At red, you need to act immediately because the situation is life-threatening. The respiratory rate is greater than 30. Capillary fill time is greater than 2 seconds. There's no radial pulse, and then the patient's mental status is deteriorated. He's not able to obey any commands. I need to act immediately. Next, you have green. Green is serious, but it's not life-threatening. It could be fracture or bleeding that needs tourniquet. You need to act, but not as immediate as that, but you need to act fast because it could lead back to the red, which is immediate. Then we have yellow. Yellow is the color which indicates that the patient is able to walk on his own, and it might be just scratches, and you could go back to the patient and treat the patient later on. What do you do when you have the patients and you need to mark them? You could mark the patients like boldly so that any medical personnel that comes will see. You mark it in a way that they will see very clearly, or on the forehead. Maybe you have a brighter one, or you mark yellow. Or if the yellow doesn't come out well, you could use a black color where the patients will come out and mark yellow. So they will know that this patient is a minor patient and you could go back to the patient later on. Thank you.